Welcome to Part 4 of our 6-part training series on respiratory protection. In this module, we'll cover medical clearance. As always, we'd like to thank the following individuals and institutions. Now that we have covered the basics of respiratory protection, we can delve into medical clearance. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. Please also note that this module includes a handout. By the end of this module, we hope that you'll be able to explain why medical clearance is necessary, list 3 questions that may be asked in a medical evaluation, and describe the possible outcomes. Medical evaluation is needed to ensure that the respirator will not harm the healthcare worker. Respirator use may not be safe for workers with certain health conditions like cardiopulmonary disease or claustrophobia. The medical evaluation includes a questionnaire and a brief physical exam performed by a physician. The accompanying handout for this module contains these questions, as well as a suggested form for the exam and results. A written recommendation of medical clearance states whether or not the worker can safely wear the respirator, and whether there are any restrictions. In some cases, medical follow-up may be recommended. This is a list of general health questions that may be asked in a medical evaluation. The answers to these questions should be confidential. Here you can see that the questions related to lung symptoms are very comprehensive and are related to activities such as walking, working, and standing. Heart problems like high blood pressure and history of stroke are also important to assess. It's also important for the evaluator to ask about any medications, as well as any past experiences with respirators. These questions are important for users of full-face respirators, since full-face respirators may cause additional problems for the user. Respirator users may need to be re-evaluated if they experience any difficulties. The physician should assess whether the healthcare worker can safely wear a respirator, can wear a respirator with certain restrictions, or cannot wear a respirator. This result is sent to the supervisor. It is the only information provided to the supervisor. Other health information is strictly confidential. In summary, workers cannot be fit tested until they obtain medical clearance. The standard medical evaluation is a questionnaire, vital signs, and a brief cardiopulmonary exam. It asks questions about past medical history, smoking status, and current medications. Lastly, healthcare workers may be cleared to wear a respirator, not approved to wear a respirator, or approved to wear a respirator with certain limitations. Their underlying health conditions must remain confidential regardless of the outcome. Here are some additional resources.